Hey everybody, it's Dr. Duncan at Siskiyou Vada Medicine. I'm joined by Dr. Sonia Halsey. We're Siskiyou Vada Medicine in Medford, Oregon. If you don't know, we're a direct primary care practice or a naturopathic direct care practice. And that simply means that we provide unrestricted access to primary care services for a low monthly fee, sort of like a gym membership. So it gives you access to work on wellness. We're a wellness-based clinic. We try and stay away from treating disease, although that does come up in urgent situations. But our goal is to actually get you healthy, and we do better when our patients are healthy. So I like this model. It works. It's been working for hundreds of your neighbors and friends and family. So please check us out online, www.siskiyouvodamedicine.com. You can also follow me on Twitter at DPCDoctor. And do you have a Twitter handle yet?
I don't have Twitter.
You got to work on the Twitter.
I don't have it.
Anyway,
whatever.
Anyway, I kind of geek out on that stuff. So tonight, well, actually, I'm going to give you a little bit of updates about the clinic first. So some clinic news. So we have some personnel updates. We have Dr. Jennifer Wyman, who's a chiropractor, who's joined the practice. She has a space here in the building.
Yeah, can I interrupt? I wanted
please.
to say that I had a treatment from her a couple days ago. It was wonderful. She really helped get me back in alignment.
It makes me think about my alignment. Awesome. How was the treatment?
It was good.
It's good.
She adjusted a couple ribs in my thoracic spine,
Awesome.
and where I get really tight.
You know what I like about Dr. Wyman is that she likes to work on people to get them healthy and then get them out. It's not, you don't get into this abyss of adjustment after adjustment after adjustment. It's sort of re-educating the spinal column, re-educating the joints, and then getting you healthy and getting you out. So it sort of aligns with our model very well.
She's really into education, and she wants to empower people to help themselves.
That's awesome.
Definitely.
That is awesome. And if you want to check out a video that she did with our nutritionist, Ron Vattel, you can look, just scroll further down on the Facebook page and check out the video. She talks about her practice and sort of get a feel for what she does and who she is, and make an appointment and come in and see her. It'd be awesome. So let's see. We also have Pat. Pat is a reflexologist and a healing touch body worker here in the clinic, and she's super affordable. So anybody that is kind of nervous about getting a massage, especially like the therapeutic sports massages, or someone who's just sort of not sure about what massage therapy is, come and see Pat. She's really good at what she does. She's been a nurse for decades. I think she's been in the nursing field for like 40-something years. Worked in critical care and recovery units, and she uses healing touch. She started using healing touch there, so she's very good. She has very good hands, and she's really good intuition. So if you're finding that you're stuck and you really need some answers and you kind of want to explore massage a little bit, I think Pat would be a really good first step. Okay, so we also have Dr. Casey Frieder, who's also a chiropractor here in the Valley, and some of you might already know him. He's been in the Valley for several years practicing in Ashland, but he offers an amazing skin clinic every month, and the skin clinic is about removing lesions non-surgically. So removing moles, warts, skin tags, anything that might look suspicious. Come in, see your doctor, and get a referral, and or just make an appointment with Casey, and he can give you a consult. But he also did a video with Ron Vattel recently, so you can scroll down and watch that. The audio's a little off on that one.
They need to redo. They're going to redo it, I think, right?
Yeah, I think so. They should redo it.
Yeah.
Because Casey is an amazing physician, and I think that you guys would appreciate his services. I had a patient with a basal cell carcinoma, a large lesion on her nose, and just a couple of treatments with Casey, you can't tell that anything was ever there, and it was done without a knife. It was done without a scalpel, so pretty amazing. Yeah, and then we also have Jean White, who's an acupuncturist here in the Valley, and she's offering something new. It's called Acumeditation. And if you know anybody that has any anxiety, stress, depression, PTSD, opioid withdrawal or addiction, then please give us a call or look at her website and get scheduled with her. But basically, you're going to be in a group setting receiving acupuncture, and it's going to be accompanied by mindfulness meditation. So
Mm-hmm.
I'm really excited about that. And she's kind of come up with that combination of items to help get you into a parasympathetic state, which is a healing state.
Does she do any one-on-one treatments?
She does one-on-one treatments depending on the person and their needs.
Okay.
So that is available. Okay, so lots of things going on. We just did a talk at the Ashland Food Co-op recently about the gut-brain axis and mood with Ron Mattel. If you guys haven't seen Ron or had a class from Ron, I highly recommend visiting with Ron, going to one of Ron's classes. He's just a wealth of information.
Mm-hmm.
He's been in the supplement and nutrition industry for about 25 years, so there's little that Ron really knows.
It's amazing. I counsel with him all the time about supplements and nutrition.
And Ron isn't joining us tonight because he has some prior engagements, but Ron is excellent. We did Facebook Live that event, so if people are interested, they can also just scroll further down on our Facebook page and check it out. At one point, I dropped the camera. I need to get a tripod for the camera. I was holding it. So 90 minutes of holding a camera still.
It got a little shaky.
Got a little shaky. We moved around. I moved around a little bit because I had to move. And then I tried to prop it up and it fell. So about 45, 50 minutes into it, if you wonder what happened, that's what happened. So it just happened. Yeah. So I'm actually looking for a tripod right now for the phone. Okay. So tonight, Dr. Sonia and I wanted to talk about thyroid.
Yeah.
We recently went to a thyroid a training in Tucson, Arizona, and it was fascinating. You know, it's like you think you know something and then you learn more, right? The thyroid is this little gland that sits right here in the body, and it controls so much. And you think, like I said, I thought I knew everything there was to know about thyroid, right?
Yeah. I was just telling that to Natalie earlier today, is that if you ever see a doctor that says they just can understand the thyroid completely, go find a new doctor. This is crazy. How intricate it is.
We learn something new every single day.
Yeah,
and
that's medicine.
And that is medicine, and that's the practice of medicine. And I love it. It's fascinating, right? So you wanted to share a little bit about thyroid, and we do have a question that I want to answer later about thyroid. So why don't you kick us off?
Well, so again, as Dr. D just said, the thyroid really, it's in the middle of so much of what happens to our body, be it neuroimmune, our metabolism, control of our sex hormones and other endocrine function. So, and it sits again right below the larynx, right below on men where the Adam's apple is. And it produces two hormones. One is called T4 and the other is T3. Way more T4 leaves the thyroid gland, and then there's more conversion of T4 to T3 in the periphery, T3 being the very active thyroid hormone.
I think that's confusing for some people.
Yeah, sure.
Especially when it comes time for lab testing too, because it seems like T3 comes before T4, right? So
So what's going on?
It's like, what's backwards? Why? Yes, and then there's also this TSH. What is the TSH about?
TSH is the signal coming from the pituitary, which is in the brain, signaling down to the thyroid gland to make hormone, to make our metabolic hormone.
Right, so thyroid stimulating hormone. I think that's also a point of confusion for people that get their thyroid tested. They say, oh, my thyroid's high, you know. And
because the TSH is high.
Because the TSH is high, right? So people might think that, oh, I'm hypo or I'm hyperthyroid. My TSH is really high. Really, you're hypo, because what it's saying is that your pituitary is like, hey, thyroid, we don't have enough T3 here. Come on, wake up. We need some more production.
So, you know, a lot of conventional doctors, allopathic doctors, and even some naturopaths that I've met only test TSH, and they say that's the only thing to test. How do you feel about that? Not to jump subjects, but
no, I think that's short-sighted. I think it's a great adjunct to just more functional testing. You know, it's like a screening protocol, right? So if someone comes in, they have some of the symptoms, and we'll go over symptoms of hypothyroidism a little bit later. And I'm sorry, but we're going to skip over hyperthyroidism. That's another topic. And we see more hypothyroidism than we do hyper. So we'll kind of put hyper on the back burner. But TSH, I think it's more of a screening tool. I couldn't diagnose, nor would I treat based on TSH.
Right, because especially from what we learned at this conference, it's like TSH really can be anywhere, and you don't know where.
Yeah, it's really a blood measurement. I don't even know what's going on in the cell, right?
Right.
What's happening in the cell? So TSH is kind of a miserable marker. Even T3 and T4. What do you think about those tests?
Well, I mean, I used to believe that, you know, if I saw something in a normal range, and I could really trust that someone's thyroid hormones were working just fine, even in the periphery. Right. And then we learned the Wilson protocol, and that's really changed.
It's revolutionized the way we view the thyroid, right?
I don't even know if you really want to test
well,
the thyroid.
I know. What's the test? So, you know, I've had situations where someone's been on levothyroxine or Synthroid or Armorthroid, Natrethroid, take your pick, right? Natural versus pharmaceutical. And the TSH will be below 1. It's like 0.1 or 0.4, which is really low. It's really tight. T3 is normal and T4 is normal, but yet they still have symptoms of hypothyroidism.
Right. So why is that?
So the blood levels can't give you any indication of what your metabolism is doing. And the thyroid is really the gland of metabolism. Right. So whenever you have a metabolic process happening, that creates heat because you're generating heat to create energy. So then you can look at body temperature and look at metabolism to figure out what is going on with the thyroid versus relying on a lab test that is sort of more of a screening result, and it's not telling you what's going, or a screening test and it's not telling you what's happening inside the cell.
Right. So just a side swipe for a second here, when he says it's metabolic, I mean, there really is a lot to that. So just knowing that your thyroid kind of rules your GI motility and how often you're actually going to the bathroom, your heart and how strong it is, how easily it's able to relax after strenuous activity, also how well it's able to contract when you need it to for strenuous activity. It also increases growth hormone. It helps lower LDL cholesterol by increasing receptors on cells.
Amazing.
It's kind of like the magic hormone of the body, really. It does everything we want to do.
It's a magic gland.
To make us feel good.
It's magic. I like it. It's become like the rockstar gland. So also, you know, I learned something interesting about the thyroid and cholesterol, and you mentioned it, is that if your thyroid's functioning appropriately, your cholesterol comes down. And your glucose sensitivity goes up. And, you know, so things like cardiovascular disease and diabetes can all be related to thyroid function. Right,
and it's also because it helps increase red blood cells and helps the release of oxygen from hemoglobin to give to mitochondria, increasing mitochondrial function. That's another reason, you know, it's really great for energy in the heart.
Absolutely. And maybe you also think about erectile dysfunction too in men, right? Releasing oxygen, creating nitric oxide, vasodilation. It's really important. It also helps with energy and mood and brain function. What does it not?
It's wrapped up into everything.
It's kind of like, and sort of, one of the hesitations we have about talking about the thyroid is you can go down a million different rabbit holes, and it gets so complex. It's tied into so many different processes in the body. You can kind of get off on little subjects here and there. And I think that anybody out there that's considering, you know, thyroid dysfunction, or they might have a problem with their thyroid, you know, you gotta see somebody who's been trained either naturopathically or functional medicine on thyroid, especially looking at the thyroid from the Wilson perspective, right? Dr. Wilson perspective. So let me just go over some of the symptoms, maybe and signs and symptoms of hypothyroidism. So it's an exhaustive list, which overlaps with so many different diseases. And the way I sort of like to address complex illnesses or chronic illnesses is sort of to cover the bases, right? So I look at foundational wellness. What can we cover that foundationally that will sort of take some of the variables off the list? So if we're looking at things like Lyme disease or metabolic disease or some neurological autoimmune condition, thyroid has to be one of those foundations that's covered, right? Because if you don't treat the thyroid, if you don't treat a thyroid dysfunction or a hypothyroid situation, then you can't really treat something like Lyme or multiple sclerosis or rheumatoid arthritis or any of the other things. And you'll see why just based on this list. So I'm going to read it from a book. This is a book that was written by Dr. Wilson. So we're looking at signs and symptoms, fatigue, headaches, migraines, PMS, which stands for premenstrual syndrome, irritability, fluid retention, anxiety, panic attacks, hair loss, increased nicotine, caffeine use, abnormal throat sensations, sweating, heat or cold intolerance, low self-esteem, irregular periods, severe menstrual cramps, low blood pressure, frequent colds and sore throats, excessive fatigue after eating, bad breath, which is halitosis, depression, decreased memory. We're just going down the alphabet. Decreased sex drive, unhealthy nails, low motivation, constipation, irritable bowel syndrome, which is a huge one. We see tons of IBS patients. Inappropriate weight gain, dry skin, frequent urinary infections, and I see this a lot in aging females, the urinary infections. Lightheadedness, ringing in the ears, slow wound healing, easy bruising, acid indigestion, acid reflux, flushing of the skin, frequent yeast infections, cold hands and feet, dry eyes, blurred vision, dry hair, insomnia, are you guys still there? Falling asleep during the day, arthritis and joint aches, allergies, asthma, muscle aches, itchiness, elevated cholesterol, which we touched on, stomach ulcers, Raynaud's phenomenon, poor coordination, inhibited sexual development, infertility, hypoglycemia, increased skin infections, acne, abnormal swallowing, premature graying of the hair. I don't know why I put it into my throat for that. I'm just thinking about my thyroid. Premature graying of my hair. See, carpal tunnel syndrome and hives.
Oh my gosh.
That's huge.
That tired me out.
That's a huge list.
Yeah.
What do you think about that?
It's a lot. You know, we actually just got a question too. I don't know. Maybe it'll help us swing into our.
All right. Let's see what the question is. Let's see. So if the thyroid supports so many functions, what can we do to support the thyroid? That's a great question. Yes. So let's kind of segue into that a little bit and talk about thyroid supporting the thyroid, and then what foods to eat, etc., like supplementation, right?
Definitely. Okay. So maybe that's a good thing for me to jump into, because I was looking at this earlier today. There's environmental toxins out there that, when we're exposed to over and over and over again, are dangerous for the thyroid. So, you know, trying to reduce exposure is a great way to start to support the thyroid. So the first one on the list, number one, is BPA, which is that chemical that's found in all soft plastics, like water bottles, and canned foods. Sadly, in a lot of infant products like pacifiers and baby bottles.
So we're just starting them out right.
Yeah, we're just like getting it in there sooner than later. Okay, and then the next one I found was bromine. Bromine is a halogen, just like iodine. Iodine is a halogen that's naturally supposed to be connected with the thyroid hormones. But bromine can compete with iodine, push it off, and then it creates a dysfunction with the hormones. All the halogens actually can do this. So that's fluorine or fluoride, chlorine or chlorate, and those two are actually found in our water supply. The Rogue Valley, I just looked it up today. It's there's a website called ewg.org. You put in your zip code and you can see what chemicals are in your water supply.
So ewg.org will tell us what's in our water supply.
Yeah.
And chlorine is one of those.
Chlorine is one of those for us in the Rogue Valley.
Right. So I know that whenever I get tap water and I let it sit, cold water, you can't really smell the chlorine.
Right.
But if you let the water sit out on your counter, especially if you put it in like a mason jar, let it warm up, and then take the top off, take a smell, and that's chlorine.
Yeah. Right.
And you can taste it.
Right. And then also other industrial chemicals, how do we know if we're avoiding them or not? It's really hard. But perchlorate, which can be found in the water supply and in our food supply because it's an industrial byproduct. Pesticides, we all know we should try and eat organic fruits and vegetables. Animals were raised without antibiotics, all that stuff. And fluoride, which is, again, another halogen. So those things we want to avoid.
Right. So that sort of, those halogens or those chemicals or compounds or elements really that you mentioned, they compete with iodine. Right. So iodine is really important for thyroid function in that the thyroid producing the T4 requires iodine to produce the T4, but also to make the conversion into T3.
Right.
Right. Okay. All right. So T3 again is the active thyroid hormone. Okay. So also looking at chemicals in our environment that affect thyroid function, but also how do you stress and trauma and surgeries, infections, dysbiosis can all affect the way the thyroid works, right?
Yeah, so stress produces more cortisol, and it actually directly stops both the production of thyroid stimulating hormone out of the pituitary, as well as T4 to T3 conversion. So it hits it twice.
Right. So so I know that I've had people that have been in car accidents, or they've lost a loved one, or they had some traumatic event in their life, and from that point on, it seemed like they got more tired, they gained more weight, they lost hair, their skin got dry, constipation, sort of some of the things in that list that I mentioned, right? So, you can't just discount, oh, I had a bad day, or, just get through it and push through. If you're feeling any of the things that I listed on out of here, you should come and talk to us and at least consider a thyroid problem, or maybe not even a thyroid problem, maybe a problem in the tissue. And sort of need some water. Can you take over for just a second?
Yeah. So what he was going to say is that it might not be the thyroid that actually is having the problem. It could be just in the peripheral conversion of T4 to T3. There's not an optimal enzyme function in the periphery. Or the T3 is having a hard time getting into the cells. So that's where we've learned also the Wilson protocol, which we don't look into detail.
So we did have a question that asked about what about those of us who don't have a thyroid? So great question. If you don't have a thyroid, you're going to have to supplement with something called the T4, right? So the inactive form of the hormone. So that's just sort of a given, because you don't have the gland that produces the hormone that you need. However, even though you're supplementing with T4, you still may have hypothyroid symptoms in that the tissue isn't making the conversion from T4 to T3.
Right.
So that's really important. If you've had your thyroid removed and you're on T4 and you still feel hypothyroid, consider having yourself evaluated for hypothyroidism, and looking at the tissue and really seeing whether or not you are converting. And a simple way to do that is actually take your body temperature, right? How would you recommend that?
Taking body temperature?
Yeah.
I think I've been advising a little differently. So I do like to see the basal body temperature first thing in the morning, and then what people look like about 3 hours later when they've started their day.
Okay.
So if they're staying pretty low through that time frame,
right. I agree. I think that's a really good, basal body temperature. What are you at resting first thing in the morning, and then 3 hours after waking? And really that gives us an idea of what's going on in the metabolism. So metabolism, again, generates heat. So your body temperature should be around 98.6. If it's less than 98.6, low 98s, 97s, I've even seen as low as 94, 95, 95. So consider that. So if you've had a long-term infection, consider it, because your body temperature might be low also.
So other ways to support nutrition-wise is getting iodine in the diet, which can happen from sea vegetables and seafoods like shellfish and seaweeds. I do say look into where they're coming from and if they're being tested for any pollutants. For mercury especially, right? Mercury, and then of course we have Fukushima just across the ocean there. So you want to make sure that you get some clean sources of either bladder wrack, which is a sea vegetable, I don't like to call it seaweed. Sea vegetable sounds a lot better. Sea veggies. Sea veggie, and crabs and so on and so forth. So I like to suggest that people get selenium in their diet to help with thyroid function, and that largely comes from Brazil nuts. Yeah, like 3 a day is the requirement. Yeah, perfect. Nuts and seeds, and then of course we do recommend supplementation, because it is hard. Not everybody has access to clean sea vegetables or iodine. So we do recommend a product here at the clinic. So you want to just introduce Thyroid PX? So restorative formulations, I'll try and get it up here. There it is. Thyroid PX, and this stuff's great because it has the the supplements and cofactors necessary to produce our active T3, which is iodine, zinc, and selenium. It also has some herbs that help detoxify the thyroid and promote a healthy thyroid, like blue flag root, Google Triphalia fruits, ashwagandha, which is actually an adaptogen. We didn't really get into the whole adrenal part of this picture.
Right, but there is an adrenal component. And if you
you
have thyroid issues, also consider looking at adrenal function.
But don't let us overwhelm you right now.
Yes.
And then also nettle leaf kelp, which is, also naturally has iodine, and ginger root. So it's a nice, I feel like it's a nice compilation of things. I've been trying it myself to see, and I actually feel the difference after only a couple.
That's pretty amazing. Yeah, I actually started looking at my body temperature, and I'm running at like 97.9, 97.8. So, definitely trying out a different approach to treating the thyroid. And, I would consider myself as being someone who's fairly healthy and robust. I eat a clean diet. I move my body occasionally. And I don't have any of really the symptoms on the list, but yet my temperature is low.
Yeah.
So it makes me, can I be more optimal? So even if you don't have anything on the list, check your body temperature and see whether or not you're running low, because maybe you are not running optimally, and it can affect sex hormones like testosterone, estrogen, progesterone, your neurotransmitters, right? So
like how well we're utilizing the energy we put into our body.
Right. How much better can I be if I were just to work on my thyroid a little bit and
Right.
my adrenal health? So,
Wow.
it's just, it kind of goes on and on. So, if you think that you might have some adrenal or thyroid issues, come talk to us. I wouldn't say that we're experts, but we're very well educated, and we have a lot of resources to share, and we kind of think outside the box a little bit.
Yes, we do.
And we're looking at treating the root cause, right? So I think that using a supplement like Thyroid PX, it contains all the nutrients and the cofactors, like you said, that would help sort of kickstart or clean off the receptors in the tissues and kickstart the thyroid and get your metabolism back on track. It's sort of an easy way to start.
I think it's a great way to start. I have patients that are just a little hesitant to start the Wilson protocol. So this is our first step. We're just going to see if we can increase metabolic rate a little bit on the supplement.
I think that's great. Yeah. And it's also people that are afraid of taking a pharmaceutical or a little opposed to taking pharmaceutical. Can we get the body to do it on its own? Giving a little bit of thyroid, giving the iris versicolor, the blue flag. I think it's just a great product. You don't have to go and take all the individuals. They've already done the work for you. So it's really nice. Mitigating your stress in your life. And I think that takes us back to, Jean White, you can do the Acumentation, also Pat, who does the healing touch and the reflexology. Coming in, having a conversation about lifestyle and food choices.
Definitely. And, I think self-care is such an individualized thing.
Yeah.
And it doesn't have to be this extravagant thing you do for yourself. Like self-care should be in every single day. If it's 5 minutes, 15 minutes, something you love to do that brings you joy and that helps you manage the daily stresses we all live through.
Right. And a little bit of exercise here and there, right?
That could be part of the self-care.
That's part of the self-care piece. That's sort of like one of the hard pieces to do, to find time to actually move your body. But this body was designed to move. And I think we did a talk on sitting is the new smoking, right? So get up, move your body a little bit, get some circulation going. It's going to help improve your mood, it's improve your metabolism, improve your thyroid function. But if you want to get started, give us a call, 541-210-5687. You can check us out on Facebook. You can also look at our website, www.siskiyvitamedicine.com. Make an appointment with us. We have free 15-minute consults. So if you think you might have something going on, come and just sit down and have a conversation with us for a few minutes. We'd be happy to talk to you. And we want to continue the Wednesday Night Lives. We're going to move the time up to about 5 o'clock, between 5 and 5:30. So if you have any questions out that are just sort of eating at you, or someone comes to you and has a question, submit it to us, and we'd love to maybe talk about it, present it as a topic at our next discussion.
Yeah, love it. I love these Wednesday Night Lives. They flew by. I
know, it's already over. Oh my gosh, where does a half hour go? You guys, thank you for joining us. Thank you for supporting us. We are so happy to be a part of your community, and we look forward to seeing you next Wednesday night. Bye.
Bye.
How do I stop it? There it is. Bye, guys.